Which of the following is a potential long-term complication of recurrent anaphylaxis? A. Chronic obstructive pulmonary disease, COPD. B. Coronary artery disease. C. Chronic urticaria. D. Inflammatory bowel disease. Answer: A. Chronic obstructive pulmonary disease, COPD. Which of the following diagnostic tests is most useful in identifying the trigger for drug-induced anaphylaxis? A. Skin prick testing. B. Serum tryptase levels. C. Drug provocation testing. D. Allergen-specific IgA testing. Answer: C. Drug provocation testing. Which of the following statements regarding the treatment of histamine shock in children is true? A. Epinephrine dosing is the same as in adults. B. Antihistamines are preferred over epinephrine as first-line treatment. C. Intramuscular epinephrine should be dosed based on body weight. D. Corticosteroids are contraindicated in children. Answer: C. Intramuscular epinephrine should be dosed based on body weight. Which of the following statements regarding the management of idiopathic anaphylaxis is true? A. Long-term prophylactic treatment with antihistamines is recommended. B. Epinephrine autoinjectors should not be prescribed. C. Avoidance of known triggers is not necessary. D. Prompt recognition and treatment of episodes are crucial. Answer: D. Prompt recognition and treatment of episodes are crucial. Which of the following is a potential complication of intravenous epinephrine administration in anaphylaxis? A. Hypoglycemia. B. Arrhythmias. C. Hypertension. D. All of the above. Answer: D. All of the above. Which of the following is the most reliable method to diagnose food-induced anaphylaxis? A. Skin prick testing. B. Serum food-specific IgA testing. C. Oral food challenge. D. Elimination diet. Answer: C. Oral food challenge. Which of the following statements regarding the management of anaphylaxis in patients with cardiovascular disease is true? A. Epinephrine should be avoided due to the risk of adverse cardiovascular events. B. Antihistamines and corticosteroids alone are sufficient for treatment. C. Epinephrine should be administered with caution and cardiovascular monitoring. D. Anaphylaxis is less severe in patients with cardiovascular disease. Answer: C. Epinephrine should be administered with caution and cardiovascular monitoring. Which of the following is a potential indicator of a biphasic anaphylactic reaction? A. Elevated serum tryptase levels 1 to 2 hours after the initial reaction. B. Persistent wheezing or bronchospasm despite treatment. C. Delayed onset of symptoms more than 6 hours after the initial trigger. D. All of the above. Answer: D. All of the above. Which of the following statements regarding the management of anaphylaxis in the emergency department is true? A. Oxygen should be administered only if the patient is hypoxic. B. Intravenous fluids should be avoided to prevent fluid overload. C. Continuous cardiac monitoring is recommended for all patients. D. Epinephrine can be administered subcutaneously if intramuscular injection is not possible. Answer: C. Continuous cardiac monitoring is recommended for all patients. Which of the following is a potential risk factor for developing anaphylaxis during general anesthesia? A. History of atopic dermatitis. B. Concomitant use of beta blockers. C. Latex allergy. D. All of the above. Answer: D. All of the above.